Hi, today let's talk about how yoga helps with mental health. Yoga is a great tool for mental health. Let's start by hearing from Dr. Bessel Kolk from The Body Keeps the Score.
Our research showed that a steady yoga practice for a traumatized person is more effective than any medication that anybody has studied. It doesn't mean that you should not be taking medications, but overall, statistically speaking, yoga in the long range has more beneficial effects than medications, etc. So part of what yoga can do for you, and having a good yoga teacher, is to help you, to give you the courage to begin to face your sensations.
Let's talk about the 8 limbs of yoga.
Yoga philosophy has what we call 8 limbs of yoga. I'll talk briefly about each and how mental health fits in. When thinking about mental health, the 8 limbs are tools to help in our healing process. The first 2 limbs, yama and niyama, also meaning self-restraints and observance, focuses on what we should and should not include in our lives to live a healthy lifestyle. What food should we remove from our lives that improve our mental health? What activities should we include that help lift our moods and aid in our mental health? Limb 3, asana, also movement and poses. These are the physical poses, also includes movements, speed and alignments of movements. When dealing with mental health, we need to understand what type of poses and movements will be helpful. Do we move through a yoga flow which has been known to help with anxiety, that allows us to refocus our racing mind and thoughts and focus on our physical body? Do we hold a specific pose like shavasana, relaxation pose, giving our body a chance to rest and heal? Or doing poses that arch the upper back like Sphinx pose, which are known to help with depression by lifting the spirit. Limb number 4, pranayama, the breath. Focusing on the breath helps calm the mind and body and helps you become mindful of how you are feeling. Speeding up the breath increases your heart rate, lifting someone out of feeling lethargic. Breath of joy. It's known to help lift someone out of low to moderate depression, raising the heart rate and speeding up the breath. Slowing the breath down by lengthening the exhale can help you self-regulate when you're feeling agitated and anxious. Limb number 5, pratyahara, withdrawal of the senses. Focusing inward, removing the senses, allows you to let go of outside influences and become aware of your needs, turning our attention inward. Often in mental health, there are outside things that trigger our emotions. Learning to let go of those and focus inward is a great tool in self-regulating our emotions. Limb number 6, dharana, concentration. As we put ourselves in a pose or a breathing exercise and concentrate on holding that pose or moving through the breath, we allow other worries to fall away even just for a moment, giving our thoughts a rest from the worries on our mind and focusing on one item. Our mind only thinks about one thing at a time. We do say that our mind is a monkey and it naturally jumps around. So the more we practice concentrating on one thing, the breath, holding a pose, looking at a candle, we give ourselves peace in that moment from our worries. Limb number 7, dhyana, meditation. Meditation has shown to help clear the mind, bring clarity, helps in trauma healing, and more. Albert Einstein said, "I think 99 times and find nothing. I stop thinking, swim in silence, and the truth comes to me." Meditation can come in many forms. Silently sitting or lying down, focusing on the breath. Walking meditation, using our senses to notice the things around us. Often those with anxiety shouldn't sit in silence. It exacerbates the thoughts already swirling around. But instead, maybe moving through a guided meditation, where the focus is on someone's voice as they walk you through a body scan. Limb number 8, samadhi, union. This is a stage of being one with yourself, a union of body, mind, and heart. Some gurus say this is rarely reached in this lifetime, and yet We can strive for small moments of samadhi when your mind, your body, and your heart are at peace, even for a few moments. Now let's look at how mental health professionals think about yoga and how they work together.
Now, in the mental health world, we operate largely from a medical model of treatment. In this model, we find diseases and we treat them. Criticisms for this model that we sometimes find in the yoga and holistic communities are that because we focus on treating the symptoms, sometimes we get the vibe that we focus on what's going wrong with people instead of what's going right. Or that we break people into parts instead of looking at them as a whole. And on the flip side, in the yoga community, we help people foster spiritual and personal development by learning strategies to help decrease your susceptibility to any mental illness or stressor in the first place. We look at treating the root of the unhappiness versus just treating the symptoms. But there are criticisms here, just like there are with anything. And in the mental health community, worst case scenario is that some people think that these yoga practices might be a little bit too woo-woo, as I like to call it. And in the best case scenario, people are actually very open to it, but they don't always understand the philosophy or the mechanisms with how yoga helps people to make these changes. But imagine if we really could integrate these two models and have proactive, supportive strategies to help improve the quality of our lives, and also techniques to help treat the distress or the symptoms when they come up. Now that, for me, would be a truly holistic model of treatment. And I'm here to tell you, as a yoga teacher and a mental health counselor, I actually don't think it would be that difficult, because I believe that these two systems have a lot more in common than you might think. So let me show you. This is the Ashtanga 8-limbed path of yoga. And historically, yoga teachers have used this as a pathway to enlightenment. In the mental health world, we would call this a treatment plan, a list of steps that we're going to take to help make you feel better. I'm not going to go into the nitty-gritty, but I want to give you a basic understanding so we can find where the similarities lie. Now, the first two steps of this 8-limbed path are known as the yamas and the niyamas. These are behaviors and attitudes that we cultivate to help ourselves improve our quality of life. And examples of behaviors that fall under these categories are things like nonviolence, moderation, and perseverance. The next step, asana, is what most people are familiar with when they think of a yoga class. These are the poses: downward dog, child's pose. After that, we cultivate what's called pranayama, or breath control, learning to change the way that we breathe. And I think of this being so helpful when we think of people who have something going on like anxiety, where we all know that feeling of not being able to catch our breath. The next step is known as pratyahara. In this step, we learn to draw our senses inward, to shut out external stimuli, so that we can really look at what are we thinking, what are we feeling, and what are we doing. From here, we cultivate concentration, and we learn to focus. Once we've drawn the senses inward, we can focus on just about anything. It doesn't really matter what the point of focus is, just that we learn how to focus on something. And from here, we achieve what some people consider meditation, true meditation. Some people call this witness consciousness. So now that we've moved inside, we've started to concentrate, we're able to use that witness consciousness to explore what we're thinking and what we're feeling and what we're doing from a place of non-attachment and non-judgment. And finally, if we've cultivated all of these practices, hopefully we achieve samadhi, or the bliss state. Some people call this unity consciousness. It's where we feel totally integrated within ourselves, possibly with our higher power, or with the greater community. Now, how does this connect to evidence-based mental health treatment? I want to introduce you to cognitive behavioral therapy. This is one of the most widely studied forms of therapy. It was developed in the 1950s and 1960s and has been extensively researched to treat everything from anxiety to depression to OCD, PTSD, or even phobias of things like spiders, heights, or airplanes. And cognitive behavioral therapy basically says, if you change the way you think and you change what you do, you will change how you feel. And this is my favorite form of cognitive behavioral therapy, which takes that a step further. And this says it's not just what we think and what we do that affects how we feel, it's also how we feel in our physical body and the environments in which we live. So having heard a little bit about both of these models, I want to ask you really, what is so different? Sure, one may be a linear model, and one may technically have more components, but look what happens when we start to combine them. We start to see that this 8-limbed path actually has a lot to offer to change our emotional state. Through practices like the yamas and the niyamas, we learn to change our behavior. Through asana and pranayama, we alleviate the physical distress that can trigger things like anxiety or depression. We learn to look inside to study our feelings, and if we're lucky enough to achieve that bliss state or that unity consciousness, that can certainly affect the way that we feel. And through the process of learning to focus our mind, we change the way that our brain is thinking, so the thought process. But through the witness consciousness, we're also looking at the thought content. What are we thinking? And we can compare and contrast what we're thinking to see how it matches up with what's going on in the environment. So, I would actually argue in many ways that yoga could be considered the original form of cognitive behavioral therapy. And imagine if we really truly did integrate these two models, using the self-awareness and the insight that we practice during our yoga practice, and then having a professional support with which we can process this experience and then obtain guidance and feedback. So for me, when I think a holistic model, I think that would be really the most holistic healing experience that we could provide. So I want to leave you with this. I said in some areas that there are people out there who still believe that yoga may be a little bit woo-woo. I hope that you leave here today understanding why I believe that is not the case, and that you consider using these practices to help yourself heal, help yourself learn, and help yourself grow. Thank you.